Hi, everyone. Welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in the studio today with Maynard Nexon healthcare attorney Matthew Roberts. Matthew, good to be with you. We are excited to have joining us today Walter Bennet. He is the CEO of MUSC Health Orangeburg, a growing regional healthcare system with 22 medical practices and 89 providers. In early 2023, MUSC Orangeburg partnered with the Regional Medical Center in Orangeburg, or as I knew it in the day, TRMC, for research and improved access to care in rural and underserved communities experiencing chronic disease, which then saw the MUSC health system assume control of all hospital operations and associated ambulatory practice. So some change that, Walter, you are overseeing there in that community. Thank you so much for joining us today.
Thank you for having me.
Can you start us off by telling us a little bit about your background and how you got into hospital administration?
Sure thing. So I guess everyone's story is a little bit different. I actually went to undergrad to thinking that I was going to become a physician. I have a degree in biology, and I just knew by the time of my junior year after taking the MCAT, being a physician is not what I wanted to do anymore. So I had to, pivot and punt, and had the great pleasure of meeting a former mentor of mine, Engel Engelmeyer, with Spartanburg Regional Healthcare System. He was the CEO back in the early 2000s, and had the chance to just to shadow him and intern with him for a couple of months. And I fell in love with healthcare from the administration side of it since then, and left left USC Upstate, where I was at the time, went and got my master's at MUSC. So I am a graduate of the program down there. And then by the time that I was getting ready to start my residency program, Engel reached out to the school and said, "Hey, do you have a guy named Walter down there getting his degree?" And they say, "Yeah." And it's like, "I want to offer him a job." So it's like the rest is history. It's been most of my
good internship you had.
Yes.
good internship. I spent most of my career with Spartanburg Regional, but I had the great pleasure also of interning or having experience with other healthcare systems throughout the state, from McLeod, Black River Healthcare, which is now Hope Health, MUSC, and just some of the other organizations that I had the privilege of working with during my early years, I guess, of my career.
Right. Well, we're glad you're here with us, and we're glad you're at MUSC Health Orangeburg. Can you tell us a little bit about MUSC Health's vision for MUSC Health Orangeburg?
So, as most of you, I don't know if everyone is aware, but the former TRMC was definitely going through some financial times.
Right.
As any rural healthcare system throughout the state have definitely gone through those rough times. Bamberg Medical Center that we had in Bamberg County and Barnwell had to eventually close back in the early 2000s. And it was coming to the point where the former TRMC was also in those kind of straits. And in the county, because it was a county-run hospital, had to reach for help. And MUSC actually came to the table of, okay, how can we help and stabilize this healthcare system? Because it's the only really hospital between the tri-county area of Berkeley, Charleston, and Dorchester County, going all the way to Lexington and Richland County. So there's nothing else really between there. And then the former TRMC is a trauma center. Well, we're a level 3 trauma center, just straddling the 2695 corridor. And if anyone knows, Orangeburg is the second largest county in the state of South Carolina. So we have a large population, or not population, but large landmass of population. But we have to find a way, how do we continue to serve those patients in the Bamberg, Calhoun, and Orangeburg counties? And so that's how MUSC came in the picture of acquiring the former TRMC.
That is such a growing area. We've been watching Charleston, Dorchester just sort of grow north along 26, right, towards where you're located. But I've also watched, MUSC. I used to live in Kershaw County. Watched them, right, do the same thing there. And we know Chester and then Lancaster, right? So, is there a vision for a corridor with MUSC, and how would everybody be clinically linked?
So, I mean, our goal as MUSC is to preserve and optimize human life in the state of South Carolina through research, patient care, and education. So that is MUSC's core. And our goal is to serve as many lives in the state of South Carolina. The former TRC, now MUSC Health Orangeburg. We're a hospital number 16 in the healthcare system, and we may continue to grow as a healthcare system. From a clinical standpoint, every hospital will have their niche, I guess. However, for the former TRMC, now MUSC Health Orangeburg, our goal is to stabilize right now. We definitely need to get the hospital where it needs to be from a standard with the rest of our hospitals within our healthcare system. And that's our current goal right now. Not really looking at, we're going to have a niche in transplant or cardiovascular services. Our goal is just to be the catch-all for all services that we need for our service area of Benburg, Calhoun, and Orangeburg counties. So currently, again, that is our goal, right?
Right. Orangeburg County, Bamberg, Calhoun, those are counties in primarily rural areas, historically big farming areas that do have high levels of chronic disease such as hypertension, diabetes, obesity, heart disease. MUSC is developing a statewide strategy to address those types of disease. But talk a little bit about that strategy and how it will be implemented in Orangeburg and Bamberg, Calhoun counties, the areas that you serve.
So with those services, again, being that one great thing about our healthcare system, we are tied to an academic medical center. It's one of the oldest academic medical centers in the state of South Carolina. And if you know anything about our healthcare system, we're actually divided into divisions. So we have 4 distinct divisions within our healthcare system today. The PD area, of course, where Florence is. We have the Catawba area where Lancaster and Chester are. And we have the Midlands area where Columbia and Kershaw are tied to. Orangeburg is a little unique because of the fact that you would think that we should be linked with the Midlands area, being that we're so close to Columbia. However, Orangeburg is actually tied to Charleston as the academic medical center. So how can we pull on some of the resources that we have from the Charleston Academic Medical Center market with the University Medical Center? So we're able to tap into the College of Medicine to ensure that we're with those resources to focus on diabetes, cardiovascular services, hypertension, just to name a few. We are big with our Dialysis Access Institute. If you've ever been on our campus, it's one of our shining stars of the Orangeburg campus. Dr. Jar Ross has been the brainchild of that institution, and it is one of a kind in the state of South Carolina. Actually, maybe one of a kind in the U.S., where we see from all over the state, North Carolina, and in Georgia currently. And we're pulling from Florida as well. We have a couple of patients coming from Florida to receive dialysis access because we do it so well there. So going back to your last question, though, from a clinical standpoint, what is our niche? You would think dialysis access is probably our niche right now, but we are focusing on how do we use our resources from the Charleston market in regards to developing a true strategic plan around those diseases of diabetes, also with hypertension and all the other elements to ensure that we are having a true primary way of focusing on healthcare and being able to utilize our tertiary or our quaternary system to ensure that we're able to link those patients appropriately for the care that they need.
Will you have residents and other specialists from Charleston rotating through Orangeburg at some point?
So we are looking at developing a rural track for the College of Medicine. in the very near future. We don't have residency programs today, but they're in the like I said, in the very near future. Either have a family medicine program with a rural track with the community hospital, the College of Medicine, because we want to ensure that some of our physicians get a taste of rural healthcare, which is totally different from a field from
Sure.
the suburban urban areas, as a Charleston, or some of the other hospital areas like in the Greenville Spartanburg area. So it's a kind of a passion that you have to be want to be a part of, because I feel like you can definitely make a larger impact when it comes to the rural area in healthcare.
That's for sure.
Yeah.
I'm always a rural fan. I'm from a dirt road. So
Right.
we started this video podcast right after the U.S. shut down with COVID in 2020. And, I remember in those early months and then, a year, just talking about the struggle of retaining your workforce and everybody's endurance. And now in your role, I know that recruitment and retention have got to be important for you with MUSC Orangeburg. What are you doing to help encourage people to come and serve those 3 counties or that region area? What are you providing as opportunities?
So, being that we are part of the Charleston market of things, from a physician recruitment standpoint, we're definitely pulling on the College of Medicine. How do we start attracting those physicians early on during their time with the college there, and also getting those residents that are part of the University Medical Center to our campus more. But when it comes to some of the other areas of nursing and therapists, respiratory therapists, or radiology technicians, we're definitely linking up with OC Tech. So OC Tech is our next door neighbor. And so we have an agreement. Actually, we just developed this agreement, MOU, back in October, where we have our high school for health professions. It's one of the charter schools in Orangeburg County. Actually, one of a kind in the state, that they focus high school students on healthcare careers. And they're able to do field studies with the hospital, which they come on our campus at least once a week, get to spend a lot of time with our departments to learn a little bit about what they do. And they're also able to take courses at OC Tech, do their clinicals with the hospital. And so our goal is to keep those students in our areas from a pipeline standpoint. We also have a collaborations with Claflin University because they have a nursing program as well. And then we're also working with Denmark Tech. So our HBCUs, we've definitely been reaching out to them on how do we develop those pipelines in those different careers as well. We just brought on board a director of workforce development, and he's been instrumental with helping us attracting, again, going back to the K through 12 students, of getting them attracted into healthcare and developing a plan to ensure that how can we get them tied back to the hospital and interested in healthcare. So that's some of the ways that we're working through the pipeline. We're also looking at how can we be creative with some of our recruitment. So we're like phone a friend. So reaching out to a lot of our current physicians. If you have a colleague in another area, please talk up Orangeburg and the great things and the impact that you've made, and how rewarding it has been for you in a rural healthcare setting. And we've definitely been able to capitalize on that a little bit more with a couple of our recruits that we brought on in the past 6 months.
Has your workforce development program allowed some of these folks that are homegrown to more easily meet the new CMA licensure regulations, which is now a little more formal? Are you working toward that end as well?
Yes, we are.
Okay. Yeah, because that's important. Yeah, because as you know, being from South Carolina, most minority populations in South Carolina experience some healthcare disparities, and that's been a big issue we've addressed from a policy standpoint, political standpoint, especially in rural areas like where you are. As one of the few minority hospital leaders, CEOs in the state, What do you see as the biggest challenge, or what are the biggest challenges to address these disparities and these gaps in the provision of care?
I say one of the things that we as a healthcare leadership is, especially with the minority population, is still about trust. How do we gain the trust of the folks that we serve? Because if they don't trust us, they're not going to utilize our services. But again, how do we meet them where they are? So we as an MUSC Health Orangeburg, we've developed several programs in the past a couple of months where we are having more health fairs to talk about health prevention, health education. Barbershop talks are one of the other ways that we are out there in the community. How do we reach our faith-based community? Because again, in the minority population, they trust their spiritual leader. So
Sure.
how can we get in with the spiritual leader on ensuring that, okay, you have to feed yourself spiritually, but how can you take care of your body as well? Because your body is your temple. So we are looking at different avenues on how do we build trust with them even more. Me as the CEO, my staff laugh at me a lot because I feel like I'm a politician sometimes, because I'm always at a town council meeting or some county council meeting, because again, I want to share about the great things that we're doing in our facility. But again, if I'm not out there sharing that information, they have no clue, and they're not going to continue to trust us.
Right.
So I've had one-on-one conversations with them. I've always, every single time I ask anyone that I come in contact with, is tell me about the bad time that you had with our organization. How can we improve from it? Because in just lending them an ear of them just sharing that information with me and telling them that we are improving, we are getting better, just give us a chance. And so that's what we've definitely been turning the tide when it comes to building the trust of our minority community and in our service area.
Very smart. That's a very good strategy.
It's great to see your enthusiasm, and I know you're from a rural area, so you understand, right, the importance of that. It's great to see your enthusiasm for this next chapter of MUSC Health Orangeburg. Matthew, I look forward to seeing what comes
It's
next.
exciting what they're doing in all the communities they're in.
Yes, that's for sure. Walter Bennet, thank you so much. You're the CEO of MUSC Health Orangeburg. Thank you for joining us today.
Thank you so much for having me.
For everybody who joined us, we hope you learned a little bit more about the changes underway and the vision for MUSC Health Orangeburg. On behalf of Matthew and the whole crew here at Taking the Pulse, we're glad you joined us, and we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.